Opioid addiction has become a nationwide health emergency, with more than 100 Americans dying from overdoses every day. Addiction can have many sources. We spoke to the addiction specialists at Sovereign Health and other professionals about the long-term tools they provide to the addict so that they can find their way back to living their lives.
When I look at patients that I've either evaluated directly or whose evaluations I've supervised, if you working backwards into their history, there is no such thing as a happy addict. An individual who develops an addiction, typically when we see them, comes to us with a history of, sadness, of trauma, little trauma, as well as big, what we would call post-traumatic type of events.
Many addicts experience pain from trauma, from bullying, from abandonment, from physical or sexual assault. The treatment of the opioid addiction begins with dealing with those issues, as well as with the physical addiction that the opioids or heroin bring on.
The reason why drugs like opiates are so concerning is because they suppress the centers of the brain that are responsible for the non-voluntary process of breathing, heart rate, keeping your blood pressure up, and when combined with other drugs like alcohol or with Valium, Xanax, other medications that we call the benzodiazepines, that acts in a way that the effect is much greater than even the two drugs added together. And so the suppression of the brainstem can be very strong in these cases, and that's obviously very concerning for us.
I'm here for heroin, meth, Xanax, currently. I was losing everything in my life, my family, my friends, everything I loved, to the point where I was living in the back of somebody's van, homeless, just with nothing. Another eye-opener for me was when I went to prison. That was a huge part of my life, and I lost 2.5 years of my life, and I have 2 strikes. If I ever get in trouble again for something, I could go to prison for the rest of my life.
We all subscribe to addiction as a complex, multi-determined experience with biological components, psychological components, social and environmental components. The question I believe we need to answer as professionals is, to what extent are we qualified, do we have competent staff who can actually assess each one of those domains? Right? Because if we don't assess it, if we don't measure it from a baseline perspective, we cannot possibly create a meaningful treatment plan that will address the illness.
Addiction to heroin is very difficult to treat. It begins with pain. The pain can be emotional, physical, spiritual. It begins usually with prior opioid use. Prescription opioid use is most often what we see.
I was a former NFL player for the Arizona Cardinals and Chicago Bears. I have 2 credited seasons in the NFL. My addiction started when I was playing for Chicago. I broke my left foot and I got surgery. I got prescribed pills from my doctor, and that's how my addiction first started. And it's a natural progression. When your doctor stops prescribing you pills, you go to the streets and you find out heroin is cheaper. Big wake-up call for me was my birthday on April 30th. I turned 30, and I just realized I was wasting my life away through my addiction, and it was time for me to grow up and do what I love in life. And I knew that my addiction was holding me back from moving forward.
A comprehensive diagnostic assessment, including an evaluation of the patient's cognitive functioning, is necessary to understand the addiction.
The assessment is vital to creating a foundation for successful recovery. In a comprehensive diagnostic situation, I think there are 2 particular aspects of a person's functioning that we need to assess. We need to assess the patient's ability to think clearly. I need to know that the patient can read and interpret in a way that's going to lead him to a successful conclusion of the exercise. And so often we don't assess that. So we may have a patient whose academic functioning is quite low, give him a task that is well beyond his or her ability. The other piece of this I think that is often missing in treatment centers is understanding the personality style, the co-occurring emotional distress, whether it's depression, anxiety, fear. How well do we assess that? Because in my experience, that's the driver. That has either helped to create the addiction or it certainly helps to maintain the addiction.
No part of America is free from addiction.
A lot of people think that heroin only affects a certain segment of American society. That's not true. 3 out of every 4 heroin addicts is employed. Doesn't make a difference how much education you have or do not have. Whether you're wealthy, whether you're poor, heroin finds itself throughout our entire society.
The foundation for every patient's recovery needs to be an individualized and evidence-based treatment plan.
I believe that the most effective treatment programs will address both the patient's brain functioning, help the patient learn how to process stimuli that otherwise might have triggered an addiction. Okay, we can't avoid our triggers. The triggers are everywhere. So we have to teach patients to not respond to those triggers in the previous way. The other thing I think that has to occur is helping a patient address the underlying feelings and emotions that give rise to an addictive behavior. I think the role of the family, the support network, is vital to involving them because the family environment is both part of the source of the addiction. It's the place where the addiction flourished, for lack of a better word, but it's also an integral part of the cure and the recovery of the person with an addiction.
For me, I was lost in my addiction. I had no structure or priorities or direction in my life, and now I've discovered what I want to do moving forward.
It's definitely different this time. Wanting to be here and actually participate makes a huge difference. Once you lose everything, it's like you can do nothing but try to figure out who you are and restart.
I think when you come into treatment, you have to make a deep down decision that you want to change everything about yourself. And that's the hard part because you've been living a certain way for so long that you have to break yourself down to almost to the point where you're a little kid again and learn a new way of life. And that's what they're doing here at Sovereign is they're giving us tools that we could carry with us when we leave here into sobriety.